Hello, hello.
Hello, welcome back, everyone. Welcome back to that medical degree channel where we're going to talk about Naplex test. So, a little review. Take it away, Zach.
Yeah, today we're talking about anxiety, which most of the drugs we talked about were talked about in depression in more detail. So if you need more detail than this video goes into, go check out depression. We went into pretty good detail about all the medications you need to know for all the psych topics, pretty much. So let's get into it. This is gonna be a pretty short video since not much to talk about anxiety. Drug treatment. Well, non-drug treatment, CBT, which is cognitive behavioral therapy. You also have St. John's wort, a 3 or 4 inhibitor. Remember that. And you can also use Valerian, Passion Flower, and Kava. So what is this Passion Flower, Mitchell?
What did you say?
What is the Passion Flower?
It's a flower that grows in South America. It can be used for, well, it can be used for tea, for relaxation. If you smoke it, it's a little, you get like a little high. Um, but yeah, that's, you know, it's pretty similar to passion fruit. To some people will probably know it's a South American fruit. Very delicious. But yeah, so it makes sense that they're actually using for CBT therapy for anxiety because it's a tea and it's a relaxer. Well, it relaxes you.
Yeah, so see, we learned something new about the origins of something today, so that's good. Getting into the first line options, you have SSRIs and SNRIs. You want to titrate these slowly. It takes around 4 weeks for noticeable effects. So a patient just start on a medication. It's not going to be magic. It's going to take a while, about at least 4 weeks for it to even start to work really well. The names in the parentheses are the brand names, and these are all the drugs you need to know brand generics for. So make flashcards for them. Use Quizlet, Anki. I don't care. Make something for these and know it. You can also search up flashcards like top 200 drugs on Quizlet and find flashcards for them. So make sure you know them really well. Fluoxetine's Prozac, citalopram, Celexa, sertraline, Zoloft, escitalopram, Lexapro, paroxetine's Paxil, weight gain, remember that, and venlafaxine, Defexor. So these are like the main drugs you'll see. Second line, you have buspirone or Busbar. It takes about 2 to 4 weeks for effect. Do not use with MAOIs, as we talked about before. No potential for abuse, HT1A and HT2 affinity. TCAs avoid if they're suicidal at all. They can be easily overdosed on. These are amitriptyline, Alevale, or nortriptyline, Pamelor. Hydroxyzine or Vistro is sedating. Don't want to use it for long term. Pregabalin's Lyrica, it's a controlled drug. And gabapentin's Neurontin. In most states, well, and where I live at, this is not controlled, but in the neighboring states, it is a controlled drug, which is starting to be more of the trend. To be honest, you don't really see gabapentin used for anxiety. You see it more for like neuropathic pain. So that's what you see it more used for in practice, not anxiety. And then you have benzos. The most common one you'll hear about is Xanax, which is alprazolam. So short-term use, he's enhanced to GABA, which is a inhibitory neurotransmitter. You'll use it for only 1 to 2 weeks and taper off slowly. I'm gonna be honest, most doctors don't prescribe it just for 1 to 2 weeks. It's usually for months upon months. LOT, which means lot. These are the ones if you're using these in the elderly, these are the ones you'll use. Lorazepam, alprazolam, and temazepam. Side effects: makes you tired, dizzy. Antidote is flumazenil. You really won't probably get any questions about anxiety on your Naplex. If you do, it might be like non-farm or might be just a side effect of one of these medications that you probably should know anyways for all these other chapters. So it's not more just testing you on anxiety, it's testing you about side effects for it for a drug that's used for like 4 or 5 different disease states that you probably should know anyways. So it's really it for anxiety, guys. Not much to it. So that's all I got.
All right. Thank you so much for tuning in. And if you like this video, please, if you learned something new, please give it a thumbs up and consider subscribing.
See you next time.